Good afternoon. Good afternoon, all. Let me first of all acknowledge the panelists here. We have Professor Mohamed Chakroun, the Vice President of Society for AIDS in Africa. We have Dr. Munya, who is the co-chair of this program. And we have Professor Seni Kwanda, also part of the co-chair of this program. We have also Reverend Jan Ganga, coordinator of the program. Then we have the team from Society for AIDS in Africa, Gordon Tambro, Felice Apana, and Emmanuel, who are all IT staff from Society for AIDS in Africa. You are all welcome, ladies and gentlemen, and fellow mentor of the Society for AIDS in Africa mentorship program. We are honored to be part of this historic milestone. This inaugural mentorship program in SAR history is the first time that Society for AIDS in Africa is organizing the mentorship program. Your valuable expertise and support will undoubtedly enhance the research capability of young abstract presenters across Africa. Thank you for your dedication to nurturing the next generation of researchers and leaders in the fight against HIV in our continent. Saying that, let us start the program by calling Professor Chakroun, who is a specialist in infectious disease in Africa, based in Tunisia. He is also the Vice President of Society for AIDS in Africa. Hello, Professor Chakroun, you have the floor.
Thank you very much, Luc, and good afternoon, everyone, and welcome to the meeting, the first meeting on mentor program training. This initiative of ESA, as the Executive Director mentioned, is very, very important. And this initiative of abstract mentorship program aims to improve the quality of abstracts submitted by African researchers and physicians to ICASA, but also to other international conferences. At the beginning of this meeting, and in the interest of saving time, I would like to ask you to introduce yourself via the chat by writing your name, your qualification, your institution, countries, and WhatsApp number, please. So, as you know, the International Conference on AIDS and STIs in Africa, called ICASA, is the largest conference in Africa. ICASA is organized by the Society for AIDS in Africa, and ICASA takes place in every 2 years in different African countries. It brings together from 7,000 to 10,000 delegates from many dozens of countries. It provides a forum for exchange of knowledge, skills, and best practices in different topics such as HIV/AIDS, STIs, tuberculosis, hepatitis, malaria, and emerging diseases, and many other communicable diseases. This conference topic: epidemiology, research, treatment, prevention, communities interventions, and other issues. The objective of this meeting is to assist mentors in guiding researchers, physicians, and other healthcare workers and community agents preparing abstracts. The planned duration of this meeting is 2 hours. We are committed to respecting the time allocated for each session in order to finish on time. And I'm happy to introduce the first speaker, Dr. Munya Saruchera. Dr. Munya will speak about understanding abstracts component, common pitfalls, and solution. After the presentation, we may have a session, Q&A session, and you can ask your question. You can ask the floor by raising your hand, or you can also use the chat to draft your question, and Dr. Munya will be very happy to answer. So thanks again for your commitment. Welcome, and Dr. Munya, the floor is yours.
Thank you very much, Professor Chakroun, and thank you to the Society for AIDS Secretariat colleagues sitting in Accra for the webinar, as well as the support that has been rendered to bring us to this point. Thanking you so much, colleagues, for all this. So congratulations to the, to ICASA, to the Society for AIDS in Africa, to the Vice Chairperson, Professor Chakroun, Mr. Luke Bodia and colleagues at SAA for the work that has been done. This is indeed an historical moment and development.
Hello, Dr. Munya, can I have 1 minute, because we did not inform them that this meeting has been translated in French and English.
Okay, sure.
All the participants know that the meeting is translated in French and English, and they can go, the French people can go, the Francophone people can go for French version in their panel. They choose French, then they will have the translation in French, and the English people can go for English, and they will have they will hear the meeting in English. Thank you so much for that.
Right. No, thank you. Thank you. So colleagues, I was saying that I was busy congratulating the Society for AIDS in Africa and also ICASA, as well as yourselves, the mentors. You are in the first cohort of mentors that are helping with this initiative and that are witnessing the launch of the abstract mentorship program for the ICASA conference. So congratulations, right round, and congratulations, Africa. Colleagues, that is my name there. I am serving as an ICASA International Steering Committee member. I'm based at Stellenbosch University in South Africa. And thank you very much. I appreciate your time. And I'm going to speak to the abstract components of which issues I think from going through your CVs, as when you applied, I'm very confident that you are all very qualified and experienced in this. But for purposes of our guideline, and then also just to walk you through, I will speak to the abstract components. For studies, the abstract submission guidelines for ICASA are such that we supposed to applicants and people who write papers are supposed to adhere to the submission guidelines, which is very, very crucial for purposes of acceptance. The key points that I'd like to highlight, have to do with the submission deadline, which is usually 3 months. And in this case, we'll be expecting that to be between the 1st of March up to the 31st of May, whatever the date of announcement, when the call has been announced. The word limit, generally is between maximum of 350 words, excluding titles and authors' names. Then the required sections, in our guidelines for abstracts is a background, then it will be followed by a description, the lessons learned, and then conclusions, or sometimes just background, methods, results, and conclusions. These vary according to traditions, either the American one, the European one, and also the professional and disciplinary differences. Then with regards to formatting, often submitted through an online portal in plain text format, and then the categories also, abstracts are usually submitted under specific tracks. That is, you'll have basic science, clinical science, epidemiology, and social science. So colleagues, when you work with the mentees, please encourage your mentees to actually start early, and review the official ICASA website for the most up-to-date guidelines. Do not leave it until the very end. Sometimes we have those challenges and unplanned things do happen that you think that you do it at the very end, but life comes in the way and something else happens, either to you or to your mentee, and things will get in the way. Thank you. Next slide. So with the abstract components, I'll focus here on mostly scientific abstracts, and then depending on the event, nature, the traditions or disciplines, abstracts vary in structure and their components. But for ICASA purposes, a scientific abstract should include the following. Number one, a title. Ideally, it should not be more than 20 words, and it should be very clear, concise, and reflective of the study's content. It should also avoid abbreviations and jargon. It should include details on the study location, the design of the study, and the population, of the study. The second section would be the background, which we again, for scientific abstracts, we encourage 2 to 3 sentences, and that should outline the problem statement or the issue, followed by a very clear statement of the study objective or research question. Next slide. Then the third section is on the methods. We encourage at least about 6 sentences, which should speak to the study design, the study setting, the date of data collection, at least some indication of timeline there, then the study participants, and what have been the inclusion and exclusion criteria that has been used to select the study participants, then the study variables, analytical methods, and this should be followed by the 4th section, which focuses on the results, and 4 to 5 sentences should do it, should be sufficient. The results should indicate the study sample size, report the descriptive findings for the study variables, and then report the outcomes for the study objective or research questions. Next slide. Then the 5th section of the scientific abstract would be, conclusions. Usually 2 sentences that speak to the, that answer to the study objective, and then the implications for policy, implications for practice or future research. Here we want to emphasize, that please do emphasize to your mentees the importance of clarity, to be very concise and logical flow between sections. I'll then move on to the second aspect. I was speaking to the scientific abstract. The second, type of abstract could be a community abstract. And for us, from the ICASA side of, looking at those issues, we would then encourage just one option that I'm going to speak to here of a community abstract. It should include the following. First section, issues. Study the specific problem or challenge in the community or in your community. Then have a clear statement of the objective of the abstract. Next slide. This should be followed by the second section that looks at the description. Describe how the community was involved, present what was actually done or implemented, share the main activities and interventions, include the scale of implementation, numbers reached, and so forth. Describe any adaptations made during implementation. And the third section looks at the lessons learned. Under this, you'll discuss the you share the key findings and outcomes, highlight what worked well and what did not, then describe unexpected challenges that were encountered and how these were addressed. Next slide, please. It will also, you'll also need to include community feedback and responses, highlighting innovative aspects of the approach used, and also noting implications for future programming and suggesting recommendations for similar initiatives. Then the next steps would be to share key findings and outcomes, highlighting what worked well, what did not, as well as the abstract submission keywords, the keywords that inform that. Here are some common pitfalls, colleagues, to avoid, and we outline here how to avoid this, and I'm sure you know this, and given your experiences and the expertise. But first one is to guide your mentees to avoid these common issues. Number one, exceeding the word limit. Encourage concise writing and ruthless editing. Suggest focusing on key points only. Suggest using informative and short sentences. Avoid tautologies. The second section is lack of clarity or focus. This is a common pitfall we also often find. Advise on having a clear research question or objective. Usually 1 or 2 would suffice. Also encourage the use of simple and direct language. The third category of pitfalls we encounter often in this is also the inadequate description of methods. Stress the importance of providing the useful information and avoiding unnecessary details, but suggest focusing on key methodological aspects. And the fourth section would look at, the fourth section of pitfalls includes overstatement of results. Encourage balanced interpretation of findings that are backed very well with evidence. Advise against claims that are not supported by the data that is presented. And the fifth pitfall is the disconnection between objectives and conclusions. Ensure that conclusions directly address the stated objectives. Ensure conclusions aligned to results, and underline the message where possible. Next slide. The last category of common pitfalls is grammar and spelling errors. How do you avoid this? We recommend thorough proofreading. Suggest seeking help from a native English speaker if needed. If it is presented in English, it could also be vice versa. Seeking help from a native French speaker if needed. Then we move on to the mentoring strategies. That is the third section of my presentation. We look at effective mentoring can actually significantly improve abstract quality. We encourage that as a strategy. Establish a mentoring schedule with your mentee. Set regular check-ins, whether you want to meet weekly or bi-weekly or however way you want it. Please make it very clear, then agree and hold your mentee to account, and vice versa. I'm sure they can also hold you to account if you don't show up or do not communicate. The second aspect is to define very clear milestones and deadlines so that these are very clear. And we also highlight the strategies around effective communication. Please use clear and constructive language, highlighting the key messages, providing examples where possible, and also using interactive methods. Encourage questions and open dialogue with your mentee. It's a relationship building. It's a relationship exercise where, of course, one needs to speak and then feedback to be able to see how it is all landing and, percolating to the receiver. The third aspect is the provision of feedback. Please be specific and actionable in your comments. Thank the mentees for asking before criticizing them. It's a very, it can be a very difficult relationship if we do not balance criticism with, encouragement here. So we encourage that, that we thank mentees for the effort that they show. Sorry, the previous slide, colleague, before I hadn't finished on the previous slide. Then you also need, of course, a balanced critique with positive reinforcement, just to encourage them, because some are completely broken sometimes when they see, that they have not been able to grasp that. Thank you. Next slide. Encouraging critical thinking, asking probing questions about the research, and helping mentees to see their work from different perspectives, as there are so many perspectives to research and also to various issues. Address language barriers where this is applicable. Provide resources for scientific writing in English, and suggest language editing services if necessary. Next slide. So, colleagues, thank you very much. This is the end of our slideshow, and I've got no doubt, like I said at the beginning, judging from your CVs and from what you have seen, you're all thoroughly very experienced, researchers in your own right, and we thank you for your availability to support the next generation of young researchers. Thank you. Over to you, Chair.
Thank you so much, Dr. Munya, for this very comprehensive presentation. I think there will be some questions, and we'll open the discussion. So you can raise your hand to ask a question or to draft also your question via the chat, and you can use your preferred language, English or French, and we can answer in your preferred language also. Thank you so much. So please raise your hand. Dr. Frederic Haraka, please.
Thank you very much. Thank you very much, first to ICASA and the entire team for having us being part of the first cohort, but also thanks to Dr. Munya for a great presentation and very insightful on abstract. So mine is just one observation that I've always encountered, particularly when it comes to abstracts and balancing the word count against common abbreviations. So we understand it's good practice for academic writing when you use abbreviations to define them at the first time before you use them later. But we do have some of these very common standard abbreviations. So maybe you could provide some experience around that. For example, abbreviations like AIDS, HIV, which are very common. Would you allow abstract writers to just go ahead and use those abbreviations prior to defining them in the first use? Thank you very much.
Thank you for your questions. Dr. Munya.
Thank you, Chair. I was happy to take a couple of questions if there were any, but for this one, I'll be happy. Thank you very much, Professor Frederic, was it Haraka there? Thank you for the question. Yes, our colleagues, I think, given particularly Society for AIDS in Africa, we really, it's about HIV and AIDS. There's a number of very common language, and common concepts that are used. And given the restriction that then often comes with abstract because of the word limit, would encourage that, then you won't need to define HIV and AIDS, because it then takes space, it takes out your word limit, because it will be only just an abstract anyway. When the full paper is developed, the acronyms, and abbreviations will have ample space to be defined in there. I hope that answers that, colleague, Professor Frederic.
Okay. Next.
Thank you. That
question.
is answered. Thank you very much, Dr. Min.
Thank you. Thank you very much, Dr. Frederic. Dr. Shidozi, I think I spelled your name well.
Yes, sir.
Yes,
yes,
sir. Thank you.
Thank you, sir, Prof. Prof, thank you, sir. I really appreciated the way and manner Dr. Munya presented his paper, and it was quite educative, and I wish that this will continue regularly for some of us who are poised to increase our knowledge in the area of HIV/AIDS in Africa. My question is very, very simple. In his presentation, he made mention of requirements for an abstract. I wish to ask if are there not supposed to be a methodology as part of the abstract?
Okay, I think we can have another question. Thank you very much for your question. We will come back for answer. Dr. Munya, please go ahead for your questions.
Yeah, thank you so much for the presentation. I'm joining in from Uganda. So these mentees have study teams that they've been working with. So there are people who know about their studies more than us. So if we're trying to guide them in a certain way, depending on what we see, the results that we see and the research question they have presented, and you try to guide her to write, but then there is opposition from probably the PI or the other study team. They want to see things differently because they probably want to communicate a certain message from their study. And you see that time is going, you're not progressing because there's back and forth, because there's the other side of this mentee whom you don't interact with, but they seem to be causing some hindrance. How then do we handle that? Is there like a fallback group that we can go to to try and resolve some issues so that the abstract can move. The deadlines are tight between starting and closing of the abstract deadlines. Thank you so much.
Thank you so much for your question, Dr. Munya. You can answer two questions, and we have other colleagues that they are raising their hand. We will come back to colleagues, and please go ahead for answers.
Thank you, Professor Chakroun. The colleagues from SAA, I think it was the fourth slide when I was talking about the scientific abstract. I think it was the third section when I spoke about methods and where I said ideally 6 sentences. I'm thinking that the colleague, Professor Chiodozi, might not have either seen it or something might have happened. You may just want to show the colleagues there, the colleagues at SAA who are helping us with the slides. Please go. I think it was the fourth slide, if I'm not mistaken. Just so that I can 1, 2, 3. Yes, indeed, it was the fourth slide from the beginning. Just so that the colleague can see that. But meanwhile, but indeed to answer your question, the third, I think it must be the fourth. Can we go to the fourth slide? Professor Chedeso, I spoke about methods. You spoke of methodology, but basically it covers that. This is what I was referring to. I did not omit it. I included it as part and parcel of the abstract. My apologies if I might have run over it very fast, or for some reason, I might not have emphasized enough. But it is catered for. It is catered for in there. Then to the colleague, Dr. Munya, is it Mayanja from Uganda? I think what you've highlighted is a very hypothetical situation. It's very difficult to give a very specific approach, but again, this is a relationship, and then we are supposed to then be engaging. If the mentee has permission from a study group or the PI to present, or rather to write an abstract based on the paper or a study that they would have done, I think at the end of the day, we may only suggest, we may only mentor and to make suggestions in what needs to be done and explaining things, and then also allowing the mentee agents to be able to determine, to be able to be the one who's in the relationship between back and forth, so that it doesn't become your responsibility as a mentor to say you want to engage the PI, you want to put things across, and avoiding some of those issues that might then arise. But I think once the mentee has the permission of the group that has undertaken the study, they should then be able to write the paper for purposes of ICASA, and then depending on where they want to go with that, they may want to publish later. The PI might have a particular view, and they may be writing. But if they're also part and parcel of that, then I think the conversations have to be happening, particularly between the mentee and the PI, the principal investigator who is involved. We can only suggest, we can only help to say that, look, as mentors, this is what should happen and the reason why it should happen, and leave it at that. I hope that answers you, colleague Dr. Munya from Uganda.
Yes, it does. Thank you very much.
Professor Chiodozi, were you answered? Back to you, Chair. I think the colleague was answered.
Okay, thank you. And please, for colleagues, don't use the chat, but to draft your question, but use Q&A questions, Q&A to draft and to write your question. So please, if you can put your question on Q&A. And we have two other questions from Dr. Naidu. Dr. Naidu, please go ahead.
Thank you very much. Thanks for the presentation. I'm Dr. Naidu from South Africa. Thank you also for allowing us the privilege and honor of being part of this mentorship program. I have two quick questions. The one is on the the tool that was shared with us earlier today, there seems to be a discrepancy with the word count because in the presentation and on page 3 of the document, the word limit indicated is 350, but later in the document on page 13, it indicates a word count of 300. So if you could just please clarify for us whether it's 350 or 300 for ICASA. And then my second question is, are the keywords counted in the word limit? Thank you.
Chairperson, I'm happy to take another question so that I can answer them both at once.
Yes, we can go to the next, Dr. Zevani.
Thank you so much. My name is Nzeimana Zefania. I work with Rwanda Biomedical Center. Can you hear me?
Yes, we hear you
Yes.
very well. Please go ahead.
Okay, thank you so much. My question is about this mentorship program for abstract writing. Is it a new program? If not new, when did it start? Maybe you can also tell us some lesson learned since the program started. Thank you.
Okay, thank you very much, Dr. Munya.
Thank you. Thank you for that. The document that Dr. Naidu spoke about, I'm not having it at hand right now, but you know, from the presentation that I have given, we indicated that you know it should maximum 350 words. That is for your, you know, excluding the title and authors. You know, that is. But when the ICASA call comes, it will be very specific, colleagues. And when the call and the announcement is made, that is going to be recorded. So it's neither here nor there. When the call will then determine, when a call comes and says abstract 350 words or 300, that is what would be used. But I think it's 350 words. That is the correct one that I recall. I do speak under correction, Dr. Naidu. And then with regards to the keywords, would this be? I think your question was that would this be included in the word count? Yes, we would. But again, I think the practice there really is just to be able to encourage people to really be very focused and stick to the keywords, because you may then have lots of keywords that are not quite key or central to the study. So in the exercise, part and parcel of all that is for colleagues to be very brief, identifying the keywords that are around, you know, their own study. And to Dr. Zefani from Rwanda, I'm not too sure at what point you might have joined, but when we were starting on, and when Mr. Luke Bodia from, you know, SAA was introducing, the abstract mentorship program is new. We are effectively launching it, and you are the first cohort. This has been on the cards from the Society for AIDS in Africa for a while, and the ideas and really beginning to see how this thing can be done. I know there have been webinars that have been given before the official launch of what you're calling the abstract mentorship program that we are doing now. So it is new in that regard. And so insofar as the program itself is concerned, we don't have any lessons learned yet. We are hoping to be getting these lessons from yourselves and the mentees that are going to come through this when we have the mentorship, you know, program that is linked to the ICASA conference that is coming up in December this year in Ghana. Thank you, Chair. Back to you.
Thank you so much. And Dr. Munya, you have also some question in your chat. Please check your chat and try to ask these questions. But in the meantime, I will give the floor to Dr. Amonshi. Dr. Amonshi, please unmute yourself, Dr. Amonshi, and the floor is yours.
Ok. Bonjour à tous. Bonjour à tous.
Bonjour. Bonjour.
Allô? Bonjour.
Oui, bonjour.
Ok. Je suis coach Amonchi de la Côte d'Ivoire. En fait, ma question, c'est de savoir quel est effectivement c'est quoi, quel est effectivement les choses, notre rôle concrètement, c'est-à-dire quel, 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 quel est le rôle effectivement du mentor en fait? C'est-à-dire, est-ce que effectivement le mentor effectivement a un cahier des charges? Comment effectivement aider effectivement nos amis effectivement à élaborer effectivement les choses, quoi, les abstracts, des résumés, de juste savoir. Est-ce que le cahier est-ce que effectivement le mentor effectivement a un cahier des charges en fait? Merci pour ça. Mhm. Ok.
Please, Dr. Munya. Thank you very much for your questions. Dr.
I
Munya.
got the question was asked in French, Prof. Chakroun.
Yes, I can give the floor to Dr. Seni one day to answer this question.
Okay.
Dr. Seni, happy to give you the floor. No. So I can answer in French for
Yeah.
Merci beaucoup pour cette question. Je pense que le rôle du mentor est d'accompagner les mentees qui vont présenter leur abstract pour certaines ICASA. Et donc, certains participants qui ont leur abstract souhaitent être accompagnés ou souhaitent que leur abstract soit revu par des mentors. Donc, dans ce cas-là, vous serez certainement ravis de voir, donc de revoir ou de réviser l'abstract et de voir sa conformité avec les règles et les normes qui viennent d'être présentées par et aussi les normes qui sont formulées dans le toolkit que vous avez reçu. Donc, l'objectif est de s'assurer que cette personne ou ces candidats qui souhaitent avoir votre soutien, qu'ils souhaitent à la fin un abstract de qualité. J'espère que j'ai bien répondu à votre question et que vous avez compris le rôle du mentor.
Monsieur le Président? Alors, Monsieur le Président, si vous permettez
Oui,
d'ajouter un mot.
oui, bien sûr, bien sûr. À vous la parole. The floor is yours, Luc.
Thank you. Oui, au fait, le mentor est là pour garantir la qualité de l'abstract présenté par le menti. Donc, ce qu'on souhaite vraiment, c'est qu'il puisse réviser et pour que la qualité qu'il présente soit une qualité supérieure et que ça puisse être accepté par le système d'abstract d'ICASA. Donc, on espère que ça va permettre d'améliorer vraiment la qualité et aussi le style et la manière de produire un document scientifique des nouveaux chercheurs africains. Merci, professeur. Vous avez la parole. Thank you.
Thank you. I hope that we answered to your question, Dr. Amonchi. Okay. Any other questions before closing this?
Ok, ça va. Merci
va.
pour la réponse, professeur. Merci.
Merci.
Mm.
Dr. Munya, the floor is yours to answer to some questions that you received in your chat, please.
Okay. No, I was looking at the chart and From my side, I think Dr. Elvis, is it Takanka, who is, a lot of them are comments, appreciation and the welcoming of the ICASA Abstract Mentorship Program. The likes of Dr. Elvis have been doing the same with the International AIDS Society. Thank you very much. We look forward to building on to that. Some of the questions from what I see, they have been answered. Someone says the chat is disabled. The question and answer is enabled. The chat box, I do not see any specific questions that may need my response here. Some of them Reverend Jane has already answered, some of the issues.
Okay.
So colleagues would like to encourage, if there are any questions that you may have, someone is asking if I could please share the slides. Some are saying they want to revise the documents, you know, those they're all various things. But Reverend Jane has said that they are going to share. They will use the email that they've used to contact you following your application. And unless emails have changed, you need to advise the Society for AIDS in Africa Secretariat colleagues to be able to capture and update your contact details, because this will be, you know, and I see Professor Chiodisi saying we think we should be specific on the number of keywords to be used in the abstract. Indeed, we will be. Here, I think it's just the two documents that you have, that one that say 300 and I say 350 here. When the call is made for the ICASA abstracts, it's going to be very specific. It's not going to be either or. And in that case, we'll be working with the details that are going to be indicated in the call, depending on the date that the call will come. We said it is normally 3 months. So if it comes on the 5th of March, it means it closes on by the 5th of May. If it's the 1st of March, those kind of details will all be very clear when the call has been made. Otherwise, that's all from my side, Chair. I'm happy to answer any specific questions if I have not spoken to those.
We have more 3 questions, and we have about 6 minutes time, so we can.
Vice President, can I respond to what?
Yes, please, Luke. If you have, we will give more information about 300 and 350 because we have another initiative that will be launched during the next ICASA in Ghana. The initiative is the Journal of SR, and I will give the floor to Luke to give you and to provide more information on this. And for the abstract journal is 350. So I think it should be allowed aligned with journal, between journal and ICASA. Please go ahead, Luke, before giving the floor to other participants to ask their questions.
Mr. Chair, I just want to confirm that for the abstract, the word is 350 always.
Okay.
We changing it. Thank you.
Okay. Thank you so much for confirming that. And I will give you the floor after that to provide more information about the initiative of a journal. So Dr. Maria Zolvo, and then Dr. Tariq, and the last we have also two more other, and Dr. Amanshi, another question, I think. Dr. Amanshi is old hand or a new hand? So, Dr. Maria Zolvo, please go ahead.
Yes, thanks. It's about the English. So we've said that, yeah, services to edit the English are allowed. Do we explicitly mention like that artificial intelligence? I think that everyone of us in academia are facing now the problem of the use of artificial intelligence. Do we promote the use of artificial intelligence? Do we suggest to use it just to edit the English? And if we promote the use of artificial intelligence, will the organization run the abstracts in an anti-plagiarism tool which can detect the use of artificial intelligence?
Okay, very good questions, interesting questions. And we take another question and give you the floor, Dr. Munya. Thank you very much for this question. Dr. Tariq Solomon.
For giving for this opportunity. My question is The one is already raised about artificial intelligence. The second one is on the matrix parts about steady variables. So maybe an abstract may have many steady variables, both exposure and outcome variables. So how we address this issue, because already we set a word limit on this. So first I need some explanation on this. Thank you.
Thank you very much. I would like also to welcome Prof. Morenike. She's with us now. She's also co-chair of this initiative. So if she wanted to take the floor, please raise your hand, Prof. Morenike, and I can give you the floor. We have two more questions, Dr. Munya and Dr. Amanshi, and then we can move to Dr. Munya for the answers and the second presentation of this meeting. So Dr. Munya. Dr. Munya.
Yeah, thank you so much. The number of people that submit abstracts for conferences is usually large, and I'm not sure if you have a feel of how many might need mentorship. Either you identify that they need or they request for mentorship if it is offered, because I see we're about 35 people here. And the question is, how many mentees would we be assigned, not to overwhelm us, so that we do a good job for people that were assigned. Yeah, thank you.
Good question. Thank you so much. And last question for this presentation, Dr. Amanshi. Dr. Amanshi.
OK. Merci encore, professeur. Bon, ma question, c'est en tant que mentor pour accompagner effectivement nos amis à élaborer effectivement des abstracts. Donc, je pense que, bon, juste une suggestion, je souhaiterais que effectivement la structure puisse nous orienter, puisse nous coacher pour que, à notre tour aussi, effectivement, on puisse aussi effectivement orienter les acteurs à produire des bons résumés ou bien à produire des bons abstracts. Donc, il revient à la structure de nous orienter sur le canevas de l'abstract afin que nous puissions comprendre effectivement les items et à notre tour aussi orienter nos amis qui sont effectivement soumettre effectivement leur résumé, leur abstract. Merci. Okay.
Merci, Dr. Amanshi. I will answer to your question in French, but before that, I will give the floor to Dr. Munya to answer the first three questions. Please, Dr. Munya.
Thank you, Chair. The question from Dr. Solomon was not very clear. I think I heard him saying two questions. One was on AI, but I didn't quite hear what the question was. The second part, I couldn't quite get him. Dr. Solomon, are you able just to clarify that for me, please, your questions?
Okay, thank you very much. My question is, there is a steady variables and the matrix part. So what are these variables, both exposed and outcome variables, and the abstract may have many variables. So all these variables should be listed on this matrix part. This is my question. Is that clear?
Yeah, you're asking about study variables, right?
Yeah.
Yes, okay. No, thank you very much for that. So if to go back, I think it was Dr. Maria, I don't remember the other, said it was the issue around the policy on AI, artificial intelligence. Look, I think for me, this is an issue that the world over we are grappling with, particularly also given the level of fraud and bribery and cheating that is happening even in the academic spaces. With my own university here at Stellenbosch University in South Africa, the university is continually dealing with the issue and trying to come up with policies that are fit for purpose. On the one hand, there are those who look at artificial intelligence as a resource, but then the extent to which it then does the work. So I'm afraid this is a policy position left to be adopted. But particularly, I think in terms of if people are going to be presenting at the conference, you know, again, we have no capacity to be able to tell even where people have plagiarized for purposes of the conference. But I think for those who may then want to take this work, because the society is going to be launching a journal, which it's a body I will speak to, and then we will get also depending on the publishing house and the position that will be taken by ICASA and SAA around that. Clearly, there is no journal that would allow plagiarism and so forth. But the extent to which I think one deploys AI and the purposes of which this is done, for purposes of writing an abstract, or for purposes of writing a paper to be presented at the conference, yeah, it will require a lot of capacity, and I think that may really be beyond us. But should those papers now want to be taken for publishing in the SAA journal that will be coming up, then of course a clear policy will be in place and mechanisms around which, you know, to be able to detect where such, you know, has happened. Dr. Solomon, yes, you're asking the question around the study variables. Look, given the limit, if it is an abstract, we are saying here an abstract should be 350. And then once you start this, you know, talking to your methods, then what becomes key is to be able to highlight the key variables around it. If there are 6 of them, and then clearly then they will take all the 6 sentences that we're encouraging for the scientific abstract. We are saying your methods section, it should be at most about 6 sentences, and speaking to the design, the setting, the data collection, the study participants, you know, variables and the analytical methods that have been deployed or used in the study. So again, depending on what those variables are, you know, it will be where those apply and where those are needed. Please then highlight that in the method section, which is section 3 of the slides that I was presenting earlier on. Dr. Munya, you were asking how many people need. Again, that one I can't put the cart before, you know, the horse before the cart, or the other way. Yes, there's always been a huge response to the call for abstracts for the ICASA conference, and most of them very poorly written, some showing promise, and of course, you know, the heartbreak that then happens to these up and coming, you know, junior and younger researchers and scientists who would want to be able to break into the, you know, having their abstracts accepted, and then of course moving on to either publish their papers and presenting at these, you know, so the bias of the conference is being towards more established researchers is part and parcel of the problem statement that lies behind the development of the abstract mentorship program. So where are the young people? You see many of them, they apply, and then others don't come back because they've been unsuccessful and all that. And those who do, when those who review those abstracts, they clearly have read them with their heads and hearts and ears to be able to really see that there was promise, if only they could get a little bit of push and support and help, which is the basis. So to tell you how many people are going to be allocated is going to be difficult right now. We do not know who's going to respond. And then when the abstracts are submitted, the issue around mentorship is going to be raised. And then those who are going to submit, they will indicate whether they need mentorship or not, because it cannot be forced on anybody, as it were. So depending on how many we then have at the end of it all, it will then determine how many will need to be allocated, and they may all be at different levels of support that they may need. Some may need far more support than others. And then also there's a whole lot of other issues. We're also trying to balance up language, for example, English and French, and then also male, female, and other, you know, genders and non-gender, you know, binary identities around that. How then do we try and add up all those different aspects? But that's no reason for us not to get started with the program. We will know once we see what has been the response and the request, and then it will be dealt with once we know what it is. At the same time, we're also hoping that we will continue to recruit suitable and qualified mentors. You now know about this. Speak to your friends, speak to your colleagues, encourage them that there's this facility. Those who are not members of SAA, encourage them to join, encourage them to also play their role as you know, community members in the research community, to mentor mentor one, mentor all. You know, that's how we will grow the continent and the world. Over to you, Chair.
Thank you so much, Dr. Munya. Just a last question in French. Donc, concernant votre rôle, comme je l'ai mentionné, donc vous devez orienter donc les participants selon le toolkit que vous avez. Donc, vous devez utiliser le toolkit. Donc, l'objectif, c'est d'avoir des abstracts de qualité et conformes conformes donc aux normes de ICASA. Et si vous rencontrez des difficultés pour accompagner vos mentees, nous serons ravis de vous assister. Okay. Just I will give the floor for 1 minute for the Secretariat. Luc, if you have any addition before moving to the next presentation.
Thank you, Mr. Chair. Thank you, Mr. Chair. Let me just inform the mentors that we have a core mentors that will be following you and that will be your support. You know, in case you have some issue, we have Professor Chakroun, we have Professor Seni Kwanda from Burkina Faso, we have Dr. Munya, and we have Professor Morenike. These are the core that will be aside and will be guiding you if you have any issue, or if you have a technical issue and you want more advice, you can have them directly. When we finish this meeting, we will create a WhatsApp group and we communicate their WhatsApp contact and email for you, so that when we start the mentorship program on the 1st of March, which we coincide also with the call for abstract for ICASA 2025, then you can engage them accordingly. Thank you so much. The last point that I want to raise is that as regard to the plagiarism, yeah, we have a software. We have a software that detects all the plagiarism from ICASA, and generally we take out maximum of 40% of plagiarism. If you have 40% plagiarism inside the every abstract, every resume, we just flush them out before we pass it on to the system. Mr. Chair.
Thank you so much, Mr. Luc. And colleagues, participants, don't worry, we can have more time after the next presentation to ask your questions. So we will come back. So my presentation, this presentation, please, sorry. So this presentation will provide you with some practical exercise and practical informations on the use of tips, of good examples, bad examples of that you can use during your mentorship.
I'm not seeing your presentation, please.
Yes, you see my presentation?
Yeah, it's not there.
Not there.
Not on the screen.
It is not on the screen. So I will. And no?
Yeah, c'est bon.
Okay, yeah, c'est bon. Thank you. So, as Dr. Munya mentioned, there are 5 components on abstracts: titles, background. Yes.
Can you increase it, please? Can you full screen? Go for full screen. Full screen.
Is it okay now?
Yeah.
Okay, thank you so much. So as Dr. Munya mentioned, there are 5 components of an abstract: title, backgrounds or introductions, methods, results, and conclusion. And you can adapt this according to the topic of your abstract, clinical abstract, research abstract, community abstract, etc. So an abstract must include points covering the following question. The first question is, what is the paper or the abstract about? Second question is, why it is important. So you have to highlight the most important point in your and data in your abstract. How did the researchers undertake the study? So you have to mention your methods, and we will come back how you have to highlight the methods and how you can also put the main data in your methods. Another question, important question, is what did the researchers find? As this is the result. So you have to highlight also and the outline and underscore the main data in your studies and why are the study finding important. So components of the strong abstract are title, and title should summarize abstract. So you have to, the title should be very comprehensive and very attractive. The title is followed by the list of authors and affiliations. Introductions. So introductions should outline the clinician problem, if there is clinical study, or the research problem or another problem, ends with a hypothesis of or statement of purpose. So, for example, in some cases, we can ask research gap. Methods should describe study design, setting, sample and control selections, outcome measure, and statistical analysis, and results have to describe the most significant findings in your research, and at the end, conclusion should summarize application of the result and outline some recommendation. So there are some tips for a strong abstract. The first one is make sure your abstract aligns with the conference themes and topics. For example, for ICASA, if you will present an abstract on CNS disease, not a CNS infectious disease or related to HIV, I think it doesn't feel it's not in the topics of ICASA. So you have to be sure that your abstract aligns the conference topics, for example, HIV, TB, malaria, hepatitis, etc. Second one, identify and carefully follow specific guidelines suggested by the conferences. Should be ICASA for ICASA, but also for other conferences, international conferences. Make sure to follow any formatting instruction and words limits. And for ICASA, we mention again that is 350 words. Third tip is think carefully about the title, because this is what the readers look at first. It's worth making it very attractive. So be careful when you're drafting the title of your presentation and your abstract. Do not waste words on the introduction. Be brief and straight to the point. You have also to clearly state the objectives of the study derives from research questions and align with results. Another very important is to make important tip is to make sure that the methods include the study design, setting, participant, eligibility criteria, and statistics method. This is very, very important. And be precise and concise when writing the results. In the conclusion, be realistic. Be realistic and think about what you can conclude from your data and what the reader will learn from your abstract or your research. At the end, perform a careful spell and language check. Do not wait the last minute to write and to proofread the content. These are some tips that you can share with your mentees. Also, don't forget that abbreviation are acceptable, but need to be clearly defined. And I think it was a question in the beginning of this meeting about abbreviation. So we can use abbreviation. We have to clarify and to define this abbreviation, but also think that you have to minimize the use of abbreviation because readers can feel frustrated when they have to go back to check what abbreviation stands for. So please advise your mentees to use and to streamline the use of abbreviation. Perform a careful final reading by another competent person if possible. Another person in your team can read and can give you some thoughts, some other vision about your abstracts. And declare any potential conflicts of interest. This is very, very important. If you don't have no interest to declare, you can write nothing to disclose. So some practical examples. The first example of abstracts is in the title. So look for this title. Normally, the norms and the standards of title is between 10 to 20 words. This title includes 32 words. Main factors associated with the immune response in people living with HIV after 12 months of antiretroviral treatment, regularly monitored in an infectious diseases department at the University Hospital Center of such city. So 32 is too much. It's a very long title. So we can use this title instead of the long one. We can concise and do brief this title, shorten this title, virus suppression after 12 months in people living with HIV monitored at University Hospital of such city. So we can move from 32 words to 15 words. Example of introduction or background. Background normally should include 3 to 4 sentences. And this is a bad one, a bad example. The aim of this study was to investigate factors associated with the immunological response in people living with HIV after 12 months of antiretroviral therapy. So what is missing here is missing a sentence to outline or to address the issues of the challenges or the problem on this abstract. This is good one. For example, several skin conditions are known to be associated with the AIDS, the acquired immunodeficiency syndrome. So this is to highlight what is the problem or to highlight the conditions. After that, our clinical observation suggested the hypothesis that seborrheic dermatitis is an under-recognized but common skin manifestation of AIDS that has important short-term prognostic significance. So this is another example of methods. This is a one sentence methods. This was a descriptive in order to assess factors associated with CD4, etc. But this is a very short and not comprehensive methods. So there are missing data on the retrospective or prospective study, on the date of the study, on the number of people living with HIV, on the setting, etc. So this one is very comprehensive. There are 5 sentences, but all data that we need for methods are included in these methods. So it's in the interest of time, I will not read this example, but we will share with you all the slides, and we can use this example, and we can use other examples and to share with your mentees. So this is a bad example of results. And results, total, for example, this is a study, abstract study of spirometry in children living with HIV. First of all, children, and they put after that aged 10 to 18.
they made to use adolescents living with HIV and not children. After that, they use some percentage without a number of people, and we cannot not use percentage without the number. Also, they use a number at the beginning of the sentences, the sentence, and we have to use letter, the number in letter. We have to write it in letter. You see here in the result, the data about the main topic, spirometry, are very, very small and not very detailed. So the writer wastes the words in less important data, and he didn't mention the most important data here. So, and this is a good example of result about seborrheic dermatitis in patients with AIDS, and you have a complete, you have all data are here. And also he mentioned the evidence, the statistical evidence of this study. And when he recommends something, this recommendation will be based on strong evidence. So in conclusion, you have here two examples of conclusion. For example, for the study of spirometry in children, spirometry remain an essential test for prevention, diagnosis, management of chronic non-infectious respiratory disease. An analytic study is needed to determine the causes. I think this is not clear and incomprehensible conclusion. We don't understand what is the main interest of this study. What is the added value of this study? In another, on the other hand, a good example, this is a significant increase in seborrheic dermatitis in people living with HIV, and the severity of seborrheic dermatitis may have short-term prognostic significance. So this is much better and a clear conclusion. So this is some examples that I would like to share with you that you can use with your mentees in your exercise with your mentees. So monitoring strategies, key strategies is based on regular check-ins, clear milestone, constructive feedback, encourage critical thinking, also address language barriers with your mentees. So as we mentioned also during the first presentation, this is the first initiative, new initiative. So we have to learn from you, and you have to learn from your mentees. And please provide us with the feedback of your mentees if you have any feedback. And of course, we will work on improving this initiative and the toolkits that we shared with you during the next few years. For example, about artificial intelligence, this is also a new tool, and our initiative is also new initiative, and we will discuss on this, and we will learn from other conferences, and we can discuss and to consider the use of artificial intelligence in the future, and how we can take some necessary actions on this. So please, if you have any feedback about this process or any feedback from your mentees, please share with us, and we can improve the process and the toolkit. About communication, be specific, stay positive, and provide example, good example, bad example, and you can share with your mentees. And for more helpful information, please visit the ICASA website. You have the website, and you may download, and you can read more information in this website. And I will be, thank you very much for your attention, and will be very happy to take your question, and also to continue the first discussion with Dr. Munya. Thank you very much. I don't see any hands. Dr. Morenike, if you wanted to take the floor, please go ahead.
Thank you very much. Dr. Munya is there. But like you noted, there are no questions. Well, I think I'm seeing two questions. There's one in French. So Professor, yes, Seda will take that. The other asked from James Lule, what exactly do you mean by defining the abbreviations? I could quickly do that. I think his reference to defining abbreviations means that if you write short things like, well, maybe HIV COVID-19 is not standard, but you do something like STI or RA, that might mean research assistant, you first define it before you continue to use the abbreviations. That for me is what I heard him refer to when he said define the abbreviations. I hope that answers the question. Over to you, professors.
Thank you so much,
French question.
Monique. So I have a question from Rosemary.
Thank you.
I'm not hearing you.
Can you hear me now?
Yes, yes.
All right. I want to ask about on the results. I realized that you talked much about statistical results. Let's assume that the abstract or the study was purely qualitative. Will you be expecting the statistics, or it was just for the sake of an example? Then my other question has to do like with the frequency of when we meet with the mentees. Is there like a stipulated time? For example, maybe say like twice. Twice per month, or any. If you can just give us an example of how frequent we should meet with our mentees. Thank you.
Thank you very much for the first question. I think I gave you an example on a quantitative study, so you can use data, and you may have also to use statistics, but in some studies, qualitative studies, we are not obliged to use, and we don't have to use also statistics. So use a statistic when you can use it, and you don't have to use statistic if any study there is no data for using statistics. So
I can reinforce that when it comes to qualitative. I think one of the things that most times when we look at the abstract, this is often weak, and that's because stories are told. So your way of analyzing qualitative data is by showing and reporting on the themes that emerged. So if you really did an analysis on the qualitative data, you will have themes you will have themes or plus or minus sub-themes. Once you have that, it's a lot more concise, it's focused, and with the themes, you can answer your study question, whether it's lessons learned or best practices, So that tells you that you did do some analysis. But once you write it narratively and it's just flying all over the place, your mentees would lose marks without it being concise. Thank you. I hope that helps. Over to you, Prof.
Thank you. For the second question, please, could you please clarify your second questions about mentees?
Okay. My question is, like, how often should we meet with our mentees? Is it like maybe we meet twice per month, or maybe once per month? Is there like a specific number of time that we should meet them?
I think there is no rules for this and standard for this. So you have to meet one monthly or twice weekly. I think it depends on what your mentee will request from your support. I think it depends on on each abstracts and also on each mentees. So there is no rules on this, and we can provide you any advice on 1 weekly, 1 monthly, or twice monthly. So it depends on the situations. I hope this was clear for you.
Yeah, quite clear. I'm answered. Thank you.
Yes, thank you. Thank you so much. Prof. Seni Kwanda, if you want to take the floor, if you have any additions in French, please. Prof. Seni.
Merci beaucoup.
Oui.
Alors, j'ai beaucoup écouté les belles présentations qui ont été faites. Ce que je voulais juste ajouter, puisque vous êtes des mentors, vous devez aider les mentis à améliorer leur travail. C'est vraiment leur dire que ce n'est pas un exercice académique qu'ils font et qu'ils ont fait un travail de recherche et ils veulent communiquer sur ce travail de recherche. Étant entendu que ICASA aussi, il n'y a pas que il y a le volet leadership, mais je vais me focaliser sur le volet recherche. Donc, à l'issue de votre recherche, c'est quel message, quand vous écrivez votre abstract, c'est quel message vous voulez livrer à la communauté scientifique? Ça, il faut être focus sur le message que vous voulez livrer à la communauté scientifique. Donc, il faut faire comprendre ça aux mentis. Voilà, ce n'est pas juste dire, oui, j'ai tant de personnes, etc., tout. Non, ce que vous avez trouvé. Si vous avez beaucoup de résultats, ben, si vous avez beaucoup de messages à passer, à chaque message, vous ferez correspondre un abstract. Donc, vous aurez à soumettre en ce moment plusieurs abstracts. Parce que vous n'avez pas beaucoup de temps, d'espace. Vous avez 350 mots au maximum à faire passer. Ça, c'est un élément important. L'autre élément, ça, je l'ai remarqué beaucoup chez les francophones, ils ont tendance à aller disserter sur des choses qui ne sont pas essentielles. Vous n'avez que quelques mots à dire. Ce n'est pas la peine d'aller vouloir décrire. Si vous êtes à Accra, de vouloir dire que vous avez fait votre étude au Ghana, qui est en Afrique de l'Ouest, qui est ceci, cela, ensuite pour arriver au lieu où vous faites votre étude. Donc, c'est la précision. Donc, moi, j'ai dit, il y a deux éléments sur lesquels je voulais partager, c'est juste dire la clarté du message et la précision de ce que vous dites. C'est ça que je voulais juste ajouter. Merci.
Thank you very much, Prof. Seni Kwanda, for your tips and advices and the clarifications. I have a question from Dr. Famara Mane. Dr. Famara Mane, unmute yourself, please. Votre microphone est fermé, please. Pouvez-vous? Voilà, c'est bien.
Allô, est-ce que vous m'entendez?
Oui, très bien, merci.
Allô?
Oui, on vous entend.
Allô, est-ce que vous m'entendez?
Oui, on vous entend, très bien.
Oui, merci beaucoup pour la présentation. D'abord, je voudrais saluer tout le monde et demander est-ce qu'on aura la présentation comme document pour qu'on puisse revoir ça. Deuxième question, c'est que par rapport aux mentorés, qui va les identifier? Est-ce que vous allez nous dire les personnes que nous allons mentorer ou bien ce seront nous qui identifierons les personnes que nous allons mentorer? Merci beaucoup.
Merci beaucoup. Prof. Seni, vous voulez répondre à cette question?
Non, je pense que c'est le secrétariat qui organise.
Ok, d'accord.
Voilà.
D'accord, ok.
Oui, merci, professeur. Vous avez parfaitement raison. Prof. Seni peut vraiment répondre à la question, mais il préfère que le secrétaire réponde. OK, on va répondre. Oui, en effet, pour les mentors, nous avons un software. Nous avons un software qui nous permet directement d'identifier les mentis et de les envoyer directement au mentor. Donc, c'est le software qui va se charger de ça. Ça, c'est un. Et de deux, ceux qui seront les mentis seront les membres payants de la SAR. Il ne faut pas oublier que la SAR est une association et que nous avons des membres. Et pour être membre de la SAR, il faut payer $25 en tant qu'adulte et $15 pour les étudiants. Donc, pour faire partie de ce programme de mentorship d'ICASA W5, il serait souhaitable que vous soyez membre à jour des cotisations à la SAR. Sinon, vous ne pourrez pas faire partie de...
Allô, j'entends plus rien là. Qu'est-ce qui se passe?
Allô? Can you hear me now? Vous pouvez m'entendre?
Yes,
Allô?
yes. Oui, on vous écoute.
Donc, je disais que pour bénéficier du mentorat, il faut d'abord être membre de la SAR en s'acquittant de ses cotisations. Les cotisations pour les adultes, c'est $25 et pour les étudiants, c'est $15. Et ensuite, nous avons un software qui nous permet directement d'identifier ceux qui veulent être mentis et on les envoie et ça vous envoie directement au mentor et par rapport aux catégories de mentorship que nous avons. J'espère avoir répondu à la question. Merci, professeur. Over to you, sir.
Thank you very much, Mr. Luc, for these clarifications. Any other questions? I don't see any hand. Is there any question in the chat? If there is no question, I think we are on time and we can take 10 minutes break. Secretariat, we have a break.
No, sir, we don't have break. We don't have break. It's a mistake. We have to proceed. It's just a question and answer.
Okay. We can proceed for the next session.
The next session, sir, is just the presentation of the software that the mentor will use for the mentorship program. And,
okay, so
and they will also have the back, and the mentee can use it directly. Don't
okay.
Our IT.
So we move for the presentation of ICASA 2025 Events Air Platform.
Okay, good afternoon, everyone. Please,
good afternoon.
In the quest of your mentorship program and our mentorship program, we will be sending a link to all the mentors, which we are saying all mentors will receive a link via their email. Sample of the link is on your screen now. You will see a message, you will receive a message from us with this content saying an abstract has been assigned to you to proceed with the mentorship. What we say is that abstracts will be assigned based on the track you selected in your registration and the languages too that you selected based on the abstract we received. Abstract will be received in tracks. So you also selected to review and conduct the mentorship in the tracks and in the languages respectfully. Taking you to the mentorship platform. If you receive the link and you click on it, it's embedded with your full name. So you see welcome, you have to say your full name on the top here. Then what we are saying is that this is a mentorship program. there's no need to score the abstract. You just have to review the abstract in details and leave comments constructively, provide the feedback to the author of the abstract. You have to click on the abstract menu here, which will take you to all the abstract that has been assigned to you for the mentorship. You will be able to filter and select the abstract based depending on the number of abstract that has been assigned to you. But as we are saying, the mentors will have to be paid SAR members. So I think the volume of abstract that will be assigned to the mentors, the mentees will have to be paid SAR members. So the volume of abstract that will be assigned to you will be much less. You will see the details of the abstract here, the name of the mentee who submitted the abstract here, the option in which the abstract has been submitted, either option 1 or option 2. You also see the title of the abstract here. Then you have to click on the view, the red button here, which says view, to get the details of the abstract. When we come to the view, after you click on the view, you now see the details of the abstract. You will be able to see the abstract title, the abstract option, the keywords used, and the track which the abstract is, the authors of the abstract, then the abstract itself. So this is where the job starts. You have to read through the abstract here and provide your feedback. We have the option for you to print. If you don't want to read it directly on the screen, you'll be able to print it and do your review. We have additional information, but with the feedback to the mentees, this is where everything counts. You will see reviewer note. You will be able to leave some notes here, which the mentee will not be able to see. This one, you can leave it for the secretariat. Will be able to see whatever you type here in your question, communicating with the mentee. The feedback that you want the mentee to address is here. You are supposed to type your feedback here. You will see comment to author. This is where anything you type here will be sent to the mentee. The mentee will receive an email saying the abstract has been reviewed by the mentor, and there's a work that the mentee is supposed to do. When they receive the email, they go directly in the system, the abstract submission system, then they will have to address it. Then after addressing, they will have to resubmit it, which you will receive it directly. When you receive, and every issue has been addressed, if the abstract does not, if the abstract is completed and does not need any further review, what you have to do is to check the completed box here. Then after you check, you will see that it says submit complete review. Then we will receive this abstract as a complete mentored abstract, saying that if maybe the issues have not been addressed, then it means you don't have to check this box. You have to kindly type your comments in here, then send the abstract back to the author for editing. That is why you have to click on this button here. Then the abstract will be sent back to the mentee. This process is not, it might not be a one-off process because it depends on the communication between you, the mentor, and the mentees. Yeah, so it can be going back and forth till you, the mentee, decide or really say that the abstract meets the criteria or is good for submission. Then you have to check the box here, and after you check the box, you just have to submit completed review. We will receive the abstract. In the quest of doing your work, if you have any suggestions or you have any inquiries that need to be addressed, you can just send it to abstract@saafrica.org so that we will address it from here. If it's any technical challenges or any challenge you have with the mentee, just send us an email so that we will communicate with them directly and proceed. Thank you.
Thank you very much, Felix, for this presentation. I think, colleagues, if you have any questions, please. If you have any questions, please raise your hand. And in the meantime, I will give the floor to Mr. Luke for any additions. Mr. Luke.
Yeah, thank you, Mr. Chair. I just want to inform them that we have again 2 more training on this software before we reach the call for abstract. Yeah, we send them. We have 2 more training only on the software for them to master it before we do the mentorship program. Thank you, sir.
To better understand the platform and the use of the platform. Yes, this is very important. Yes, thank you for this information. Dr. Frederick.
Thank you, Professor. I had a quick one on the platform. From how it was presented, it appears that we resubmit back the review to SAA. So my question was like, I wasn't sure whether that would constitute a submission of the abstract, or they still have to go back again to submit on the abstract submission platform, and then the abstract go through the standard review process that other abstracts are going through. Thank you.
Thank you very much for your questions. Felix, yeah, you can understand? And you can answer the question, please?
Okay, thank you. So what we are saying is that for the mentee to be able to join the mentorship program, they first have to submit the abstract. When you submit, we have the copy of your abstract on our platform. Is that abstract that goes for editing and the review and the mentorship? That abstract is the one we are using for the mentorship. The last submission we are saying here is after everything has been completed. If you just click submit completed review, we will see it as this is the last update of the abstract we are receiving. But all the abstract does not need to go to the mentor again before they resubmit. Once they are starting and they check they want to be in the mentorship program, they will first have to submit the abstract first before they continue. Thank you.
Yeah, Mr.
Thank
Chair.
you very much, Felix. Yes, please.
What he's saying is that when they review from the mentorship program, when the mentor say yes, completed, it go directly to us. And when it come to us now, it go through the peer review process, the blended process for ICASA. It doesn't mean that go for ICASA accepting matter. No, it go through now the peer review process for blended process for ICASA to finalize and to select. Then it means that we have 2 systems for the mentor for the abstract submitted. If you are submitting your abstract and you are a member of SAR, you can click I want to join the mentorship program. If you click it, then your abstract will go directly to the platform of the mentorship program and will be assigned to a specific mentor. And the specific mentor now will start reviewing and give you comments. And then you as a mentee, you work on the comment and you submit it back to the mentors. And it's the mentor now to review and say, okay, it's okay. When he says it's okay now, it goes directly to the mainstreaming to submit the abstracts. This is the way it works. Now, if the mentor review and the mentee is not satisfied, the mentee also can submit it directly. He submit it directly, then mean that he go directly through the blend review process for abstract management system. Thank you, sir. You have the floor. Over to you.
Thank you so much for this clarification. That means when the abstracts, when the mentor said okay, that means the abstract completed the mentorship process of our reviewing, and the abstract will move to the next step of ICASA abstract. That's clear?
Clear.
Okay. I think that's clear for colleagues and participants. Any other hands? Any other questions? And you will have 2 other sessions about the platform and how to use the platform and how to resubmit the abstract and to discuss the abstract for with your mentees. Any other questions? Any other hands? Question on the first presentation, second presentation, on the presentation of platform? Feel free. If you have any comments or presentation or questions, please. I don't see also question in the chat. So I think if there is no other question, we can move to the last session, closing session. As we mentioned, this is first initiative launched by the ESA for the first time. So is there any questions? Yes. Dr. Adou Francis. Dr. Adou. Dr. Adou, please unmute yourself. Votre microphone est fermé. Voilà. Please. S'il vous plaît. Vous pouvez prendre la parole. Please go ahead.
I think he's facing some network challenge.
We are not hearing you. Je vous entends pas, Dr. Adou.
So I believe that he's facing some network challenges. He can write his question in chat so that we take it up.
So please write your question dans le box question-réponse. If you have so please write your question. We will come back to your question, Dr. Adou. Unfortunately, I think you are facing some problem with the sound. I see a question. What is the duration of the mentee review period case in the abstract is initiated late, perhaps a week to deadline? You can answer this question, Mr. Luke. What is the duration of mentee review period?
Thank you, Mr. Chair. The duration of the mentee review period is the same duration with the call for abstract. It will start the 1st of March 2025 and close 31st of May 2025. The same.
Okay. Okay, thank you so much. So I don't see any other hand. So please, if you have any question, raise your hand. Otherwise, we can move to the closing session of this meeting. So thank you very much for your attendance and your commitment. And as I mentioned, and we mentioned in the beginning of this meeting, this is the first initiative launched by the ESA for the first time, because we think that it is very important to improve the quality of abstracts submitted to ICASA and to other international conferences in order to increase the visibility of research in Africa and also and outside Africa. All the presentation, as I mentioned, will be shared with you, and we'll be happy to continue supporting you. I think all this presentation shared some advice in the toolkits of abstracts, how to write abstracts, and best practices, how to write good abstracts. And these initiatives will be followed by another important initiative, is the Journal of Society for AIDS in Africa, that will be launched in the next ICASA 2025 in Accra. So you can publish in 2025 after ICASA your research and your papers. So we hope that this meeting was useful for you. And for us, you are our ambassadors of SR. You have to do the work for the good of the SR and in the interest of SR. We are very happy, as I mentioned, to continue working and assisting you. And we are counting on you to make this initiative a success. So let me thanks the Secretariat of SR and the consultant and the co-chair for all efforts made in preparing the toolkit and the slides and also the organizing this meeting. Thank you for Prof. Munya, Prof. Seni, Kwanda, Prof. Morinike that had co-chaired this initiative and for their support to this initiative. Thank you also for Mr. Luke and all the team for the great work made to make this initiative a success. So before closing this meeting, I would like to give the floor to Mr. Luke to share with you some more information, next step, and contact information. Please, Mr. Luke, the floor is yours before closing this meeting.
Thank you, Mr. Chair, Vice President of Society for AIDS in Africa. Let me inform our distinguished guests that for this mentorship program, the Board of Society for AIDS in Africa believe and think that we should give you some incentive. And the first incentive is that after this program, you will receive a certificate mentioning that you are mentor of ICASA 2025 mentorship program. And the second is that you will have a free registration to participate to ICASA. The third is that we are planning, the board is planning, the core member are planning how to give you a token money so that you can buy airtime, because to follow up with your various mentees, you need to have strong internet. We are planning to do that. And also, you have a free 1 year of membership of Society for AIDS in Africa, counting from today. As from today, you are a mentor of Society for AIDS in Africa. This is a few 4 points that I want to share with them, the benefit to be mentor of Society for AIDS in Africa, to help us to organize this first mentorship program for ICASA 2025. Thank you, Mr. Chair. I would like to take the floor also to say thank you to all the mentors. Thank you for your engagement, your commitment, and your time. We believe that we meet next time for the training again on the software, on the platform that we use to facilitate the mentorship program. Thank you, Chair. You have the floor.
Thank you very much. I see two hands before closing this meeting, Dr. Munya and Dr. Rosemary. Dr. Munya, please.
Thank you, Chair. Just to thank you as well and to thank the colleagues at Society for AIDS in Africa. Chair and Mr. Budia, I was thinking, may the mentors find us more mentors. We rather have a tough competition of people trying to come into the mentorship program and putting others on hold. I think somebody said it earlier on that how many can they support, how many can they expect? So please spread the word, particularly I think to female researchers, so that we have them in the space. And also, yeah, I think even the French side is underrepresented. We're very aware of that. Can we spread to those who are bilingual, to those who speak French, and others? I just thought I should add that the more the merrier. Thank you.
Dr. Rosemary?
Thank you. I just want to ask about the incentive, where you said that if someone will get like a free registration, is it? A free registration for, I mean, free subscription, right? For 1 year?
Yeah, you have you have free subscription to be SAR member.
Okay.
And registration to attend the ICASA conference in Accra from 3rd to 8th of December 2025.
All right. I wanted to ask that if someone has paid like for this year's subscription, How will that work?
Yeah, if you have paid for this subscription, it means that you are the best board, you are the best member of SAR.
Okay, okay, that's fine. I thought maybe the person will be given another year. Thank you.
Thank you. Thank you so much. So, colleagues, thank you for your commitment. Thank you for your time. Also, don't forget that we mentioned that we have another initiative to be launched, the Journal of SR. And when you are mentoring your mentee, you should encourage them to publish their research in the journal. So please select also the good abstract and encourage physicians and the researchers to publish their research in our journal. This is our journal, your journal, the journal of our society. So you have to support this initiative, and I'm sure that you will be very happy with the journal, and you will contribute in the success of this journal. So again, thank you so much for all your time, for your engagement, and thank you for also co-chairs, Dr. Morenike, Dr. Munya, Dr. Seniko Ande, and many thanks for Mr. Luc Boudea and all his team for the great job. And we are all working for the success of and the best of our society, and wishing you very pleasant day, end of day, and I think we will have some opportunity to meeting you before the next ICASA. Please also, if you have any support, we are very happy. Our co-chairs are very happy to continue supporting you via chat, via WhatsApp, or via also email. But I'm sure that you will do a good work with the ICASA and with reviewing the abstract. I'm sure that this ICASA we will have the best abstracts and the best also abstracts to be published in our journal. Thank you very much again, and in the next meeting. Bye-bye.
Bye.
Bye-bye. Thank you.
Bye. Thank you.
Bye.
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 Merci, au revoir et à bientôt.